Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Okay. Good evening, everyone. You're welcome to Early Intervention Matters. This is a podcast that's been set up to have discussions with family members, to have discussions with the public, and share knowledge on various diverse conditions that affect children. So previous episodes have covered different topics, and I hope you've had a chance to listen to them. Also have opportunities to speak to families, to speak to young people on our podcast. And I'm very happy today to share the platform with one of our lovely families who's going to take us through their journey of seeking help for the neurodiverse children, and also the challenges, because we are all very much aware of how different this journey can be for different people. So I'm really pleased today that I've got Izebua joining us today, and I'm going to hand over the introduction to Izebua because she is a woman of many parts, but a very, very motivated, very, very promising woman, and I've learned a lot from her myself. So I'm just going to hand over to Izebua. Please introduce yourself.
Thank you, Yang. So I'm Izebua, and thank you for inviting me to join you on this podcast. This topic is so dear to my heart, so thank you for sharing this platform with me. I'm Izebua. I'm a mother of 3. I have 2 young men. I was going to say 2 boys, but they're now young men, and a daughter. And those 2 young men have taught me so much in the journey of the neurodiverse world. They both have special needs on different levels of the spectrum. So I'm happy to talk about my journey. I currently am in the UK, but I started my life in Nigeria. And there's been a lot of transitions by moving from Nigeria to the UK. So hopefully we can talk about that and unpack it for families that may be going through that same journey. My first son is 19. My second is 17 right now. So it's been almost 2 decades of having to navigate this journey. And so hopefully I can share some tips and lessons learned and pass on information that may be helpful to others that are listening.
Thank you so much, Izebua. I'm very sure our audience will learn so much from you, because I have learned so much from you and your resilience through it. And that's why I'm really pleased that you've joined us, because you will be sharing quite some useful tips. So before we go further, and I just want you to, because obviously you've told us you moved from Nigeria down here, and I think that's an important message, because we have quite a lot of families recently who have moved across continents, who've moved from their home countries to other parts of the Western world, and some of whom have children with additional needs. So I think from your particular story, would you want to shed some light on your journey whilst you were in Nigeria, and when the children found to have these differences, and what was it like accessing services there?
Okay. So just to make it clear that my moving over here was work related. So my job moved me over here. So it wasn't necessarily the moving for support, but work brought me here. So we can talk about that later. In terms of Nigeria, my journey started from birth. So it wasn't, for the first one, it was from birth. We had some challenges at birth, and then we already knew that we should expect needing a lot of support at the time. My second was something that we saw as he started to grow, about having additional needs. If I look back at Nigeria, I think the thing about it is, first of all, having that right support system and not getting too embroiled in the negativity of, one of the key things I always notice is that stigma, the cultural and customary ways of looking at things in Nigeria. Being able to deal with that as from an emotional point of view, or perception of who you are as a family or your children. That is on the one hand. In terms of medical support, we did have medical support, but obviously the extent to which there's exposure or inclusion is another challenge that we have back home in Nigeria. So if I cast my mind back with my first son, who has multiple diagnoses, but mainly managing, epilepsy, managing health needs. And then it's just really making sure that you have the right medical support around you and being able to communicate. I don't know how to explain it, but getting the right type of diagnosis that is not trivialized. To say, okay, I've noticed this about my child, and they say, oh, don't worry, just wait. He's a boy. Those are the kind of things that you have to overcome, that it's not trivialized. Making it seem as if these are things that you have to wait to have intervention. From a schooling point of view, I think once again, there was always that journey of making sure you had the right school that understood the children. We're not isolated and we're included in the groups. That for us ended up being a situation where we had to then go outside of our, what was, like, stretch ourselves to get additional support by paying for personalized support, having therapists that will come and support you in the home. But these therapists are not necessarily fully trained. They're just people that are very earnest and using their best efforts. And so when they were young, we had some speech therapy, occupational therapy. But when you say that you have a speech therapist or an occupational therapist, it's not like they've been trained. They're just people that are passionate. So then we had to be really involved in putting together the program for the children outside of school. And then in school, trying to make sure that the teachers understood them. And then there was also a parental inclusion. Everything is now seeming like a blur, but all I remember is that we always had to look for additional support. We just had to keep searching everywhere, keep looking for who could provide it. We were in Lagos at the time, so you find out that there are just maybe 1 or 2 or 3 very popular providers. But then what they have supporting them are not clearly trained, like if I have on this side of the world. Well, another thing that we had, as when I think about the positives, is just having that additional support. Maybe you have an extra nanny, you have a driver that can do your running around for you. But at the same time, it's not like you're just doing your best, not necessarily going with any structure, but you're just doing your best. And I think another thing is maybe that diagnosis again, maybe the challenge of not getting an early diagnosis. And then maybe people just think your child is naughty, child is fault, those type of things that you have to. And then you start to think that maybe you need to just do something, work harder towards making sure your child is fitting in, but not really getting that fact that there are different things that are at play. If you have a child on the autism spectrum, for example, not understanding that the demands of the day are actually affecting that child and building anxiety. So that knowledge, you know your child, you know what to do, but you don't have that technical knowledge. So I think that would have been the challenge in Nigeria. There's always the earnestness of supporting, but not quite knowing what your support plan is supposed to be. I don't know if I'm making myself clear.
So you said that people would want to support, but not knowing what that means technically, interpreting it and how to support the child, the not of what the support means.
Exactly. So let me try and be a little bit more structured and say, from a medical point of view, so for my son that has medical needs, the doctors are there, they can support. Then I think when there's a medical need, you also have that emotional support that you need to have for the child. So understanding the demands. So in Nigeria, another thing is that when we have children, we talk about academics, you have to write, you have to read, you have to do all of those things and start putting all those demands, right? And it has a genuine place there, but you also have to realize that sometimes we like to do a lot, thinking that by the volume is going to be the progression. That's been a change in mindset to say, look, I remember the early days we would do the whole day. The intervention, it just put a lot of demand. It eventually brings a lot, but under a lot of stress for the child. So being able to understand those, those parts of, understanding the training, the intervention being very clear that it's not the muscle that you put into it. So then when somebody back home will say, I'm a speech therapist and therefore you must do 20 hours of speech therapy a week. You'd be like, yes, I have the best person because we're doing intensive speech therapy. You don't realize that part of it, you have to give the child time to internalize what they've been trained in, and once a week or twice a week is actually okay. And I'm laughing now because I'm like, I can't believe that this was ever a thing, right? So in terms of education, it's really understanding. One of the challenges is understanding that the child is not just learning academically, but also learning functionally. And all those terms, you may not know distinction back home because nobody's talking about it from that structured point of view. They're just thinking, do more, do more, do more, so that they can accelerate, and not realizing that acceleration is not necessarily demand. Right? So that's from academic point of view. And then understanding that when you're also training, depending on what your child's needs are, you have to train for functional skills, being able to take care of yourself, how to do the basic things. So not just reading and writing, but how do you build independence? So I think that was one of the things that might be lacking back home. We have some very good people that they're few and far between, but some of them understand that concept and are able to say, look, when you bring your young person to my setting, I'm not going to talk about just reading, not going to talk about can you feed yourself, can you take a bath, can you do all of those things. So those are the kind of things that we eventually learn as we went along. I think by default, it's balanced in terms of making sure we can bring them to the best possible outcome they can, so making sure they knew how to button their shirts and take care of themselves. But it's always about putting a lot of effort. And I think back home, parents just need to understand that it's okay to feel like it's overwhelming. It's okay to feel like out of control. And then make sure you have the right support to take you on that journey. Because once again, I think back home is always about being strong enough to resist the stigma and accepting your child and letting everybody else accept your child. And which is very hard. But I mean, if you do that, then you find out that your children have a lot of self-esteem because you demand from everybody to treat them like individuals. And I feel like I'm saying so many things. So let me stop here and let you ask the next question.
Thank you so much, Izegbua. I think it's just been enlightening to hear you describe that, because precisely what you've talked about is what I sometimes hear a lot of parents go through. And interestingly, I had a focus group discussion with families back in Nigeria. And one of the things everybody was stressing that the therapists were asking them to do so much. Some people were doing therapy 5 days a week, 6 days a week, thinking that that was what was going to turn things around. And I think it's that understanding, which you have clearly outlined in the discussion, is about, it's not do more, do more, do more. It's about also thinking about what's the outcome that you want for the child, and working the functional outcomes that you've described is extremely important. And I think when we shift from thinking, do more speech therapy so that we can get you to this level so that you can begin to be like everybody else, then if we shift from that mindset, then the stress is down, because then the child is not competing against other people. The child is just working towards achieving their own potential. And I think this is one key message you brought out, trying to get families to understand that the key is trying to get that child to reach their potential, because they've got a lot of strengths, and that's what we need to look at. So yes, that's really interesting. So that was the journey there and the educational challenges. What about moving to the UK, trying to navigate a new environment with the needs that your children needed? Do you want to talk a bit about your experience with that? Because that's that transition, isn't it, that we're talking about?
Yeah, I was glad to know that it was a huge culture shock for me, a huge shock, very, very destabilizing in the sense that, when you're back home in Nigeria, you're like, okay, I'm coming to the UK, and therefore everything I've heard about education, and I will just come in and I'll call up a school and then say, my children are here, sign them up. Culture shock to realize that the system is different. So for anybody that is abroad that is thinking about moving, do your research ahead of time. Understand that, especially if you're coming from Nigeria, back home in Nigeria, all you need to do is just to drive into the gate of the school and then say, I want to see the principal. And they'll say, sit down for 5 minutes and you see the principal. And it's not quite the same here. Things like understanding that you need to do reports, assessments was news to me. So understanding that you needed to have assessments by specialists, didn't realize the importance of that. So for anyone that is listening, have your assessments done up to date. And does an absolutely amazing job with that. Partner with your pediatrician to know who to signpost you to the right people. And then I guess another thing is that the special educational system here is very, how do I describe it? It's complicated, right? It's not straightforward. So I'd say for anyone listening, just give yourself lead time to understand that it's not going to be an easy walk, because you have to have assessments done. You have to have schools determine whether or not they can support your child. And then obviously all of that, you're not the only one that's trying to get into those schools or get support. Kind of like building another level of resilience. I thought I was strong or resilient before. I think I grew additional muscles in places that I didn't realize I needed to have muscle. So you don't need to come with that mindset of it's going to be a change, and you have to advocate for your child. So advocacy would be a different type of advocacy. It's not to put my child in a box or whatever. It's a different type of advocacy to say, look, this is who my child is, and this is what I do about my child. And being able to pass on that message in a way that you're communicating without necessarily being aggressive. So understanding the language and the culture of your environment is really another important factor that we don't realize, that you are navigating a different communication style, a different response to the way you speak. So I think that you have to take that into consideration. Now, finding the schools, again, it's almost like trying to get the schools to understand your child. And then if you then find yourself in the wrong environment again, your child may also regress, because the child is also dealing with change. And I think people have to realize that even you as adults, you may already be dealing with it from, culture shock and everything. Imagine a young person that is already dealing with their own personal, additional needs, and they now have to change the environment. They need to deal with a new climate, new culture, new people that they're seeing. So that again is another area to manage. The fact that if you have a child that is nonverbal or is verbal and has anxiety, you have to realize that the child is also having to navigate the change. So everybody is changing. So being able to help them along that journey, and at the same time having to advocate with people that don't know your child. So that way, if you do an assessment, you also try not to be very passive in the process, because in some cases they may not understand your child because there's a cultural difference. So if you see an assessment that is not representative, don't feel intimidated to speak about your child. Let them know what your child can do or cannot do. So you don't have the misdiagnosis or misinterpretation of their abilities. Now, the UK has so many schools, so many. So it's also another journey to try to narrow down to what setting is the appropriate setting for the child. And then coming at the right stage, so many layers of it. So the child comes in at a key stage transfer. Maybe they're coming in at the age of 9 or the age of 10. And that means they're about to go into secondary school, and your child is still at primary school age, dealing with all of that. Understanding how they are going to settle into the new classroom. So there's so much. And I don't even know, I feel as if that there should be a podcast just on this, but not really being able to understand how to place your child. Another thing that people may not understand is that there will be delays. So if your child has special needs, it's not as easy as someone that is neurotypical and is just going to transition immediately. So when you're waiting for assessment, potentially there could be delays where your child is out of school. So how do you manage that transition if you're working? So again, this places a lot of stress on families, and having the right partnership to be able to deal with that is also another issue to deal with. And then if you're looking for, in some cases, you may be able to find schools that are paid for. In other cases, even schools that are paid for may feel that they can't support your child. So how do you manage that? So working closely with the local authorities to try and get the proper assessment, what we call an EHC, and making sure that you go through the timeline. So again, while you're working or trying to settle in, you're having to deal with that aspect of educating and supporting your child. That's educationally. And then you also have the medical transition. So you have to do all these reviews with doctors. So it takes a lot of you making sure that first of all, you're keeping yourself under check and not losing your mind. And you're not losing your temper. So really trying to build that ability to persevere in a very, how do I put it, like a persistent way without necessarily going side. Because if they go negatively, you're not going to make any headway. What else would I say about that? So at the end of the day, you find out the right people that can assess your child, partner with them. And I guess my key word for that's just popping into my head now, is just persevere. Because at the end of the day, if you know exactly what you want for your child, then you might as well just stick with it until you get it. So in some cases, if you find that your child is out of school, you may have to just figure out how to have personal tutoring in the meantime, so you break the gap. And at the same time, be conscious of the fact that your child is already feeling probably left out. So building that kind of support system where the child can have other social activities in the meantime, and then, just keeping a positive note to say, look, it's not you. Yeah, we accept you. You're accepted by everybody. It's just a transition. I'm building their self-esteem in the meantime. But what I can go back to is that when it does settle and you get the right provision in place, you start to see the progression. And so in the meantime, the main thing I always say is protect the home, protect the atmosphere of the home and around the child, to say, look, even though it's difficult, I'm the adult that is dealing with the challenges. So for you, I'll put in place whatever it is I can put in the meantime so that you don't feel like you're not regressing. Then once you come in, like I said, when you come out of that intensive 6 days a week of 20 or 5 hours a day of therapy, and you now come here, don't be shocked when you hear that you're going to have speech therapy once a week. And don't think that, oh my God, my child is not going to make any progress. You will find out that, look, like I said at the beginning, it's about knowledge and training and structure. You realize that if you're getting something consistently over a period of time, you start to see the progression. So we like the quick win. We like the fire on the mountain, everything's coming and dying, and we're all going to get it immediately. No. I think one of the positives, I'll say the positive of being in the UK, is that they'll say the time will come. And the person, another one of my culture shocks was waiting list. What's the waiting list? Honestly, I always say that one of the major is in which in Vegas, you just drive to the hospital to see the doctor, and you're seen. And here you come and they say, oh, yes, I can do your assessment, and you come in 5 months then. You're like, what do you mean? Between 5 months, what's going to happen? I have a auntie that says, the day will come. Will you wait? Everybody else is trying to get his thing. So he waits until his time. And eventually that day is going to come. So I think one of the things that you see when you get over here is, first of all, understanding that there's a period for things to happen. So there's a process. And which is a good mindset to understand that your young person that you're taking care of or you're building their skills, it's all going to come through a process. It's not going to be the 20 hours in one day. It's going to turn the switch. It's going to be the continuous, intervention that will bring the outcome. So that was the key thing that I learned when I...
Thank you, Izebua. That's so useful. I'm sure our listeners have gotten lots and lots of tips from what you have said, and yes, and I agree with you. It's got to be a different podcast to go through because you've given us a booklet of information that's so useful for families. Thank you for that. As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening, Aim.